I want to thank the senior senator from Michigan for her words today, but more importantly for her advocacy for so many years, and maybe especially in the last year, on the Children's Health Insurance Program and all the great work that she's done. This is a program which has been bipartisan for a generation. I speak from the vantage point of Pennsylvania. It's been bipartisan in my home state for even longer than the federal program. In Pennsylvania, the program was passed in 1992, became law in 93, and so for longer than the federal program, which many people know started in 1997. It has personal connections to me. My father was the person who signed, or I should say the governor who signed the legislation into law in 1993. And since that time, every Republican and Democratic governor, and for the most part, the legislature of both parties has supported it, which is the case, or has been the case here. It's only lately that CHIP has become contentious. The tragic irony here, or if you wanted to use stronger language, I'd use the word insult, is that in this case, you had legislation to reauthorize, which is a fancy Washington word for do it again with maybe some changes, but the legislation was reauthorized way back in the fall and was ready for passage here on the Senate floor. The majority leader indicated that it had to get through committee, and it did. And so we had a unanimous vote in the Finance Committee to have children's health, to have that program be part of our law going forward. And what happened? Well, the deadline was September 30th. The Republican majority had the opportunity to bring that bill, the KIDS Act, that was the bill, to the floor. If that bill were brought to the floor, it would have passed in a matter of hours, if not less. The majority decided not to bring the Children's Health Insurance Program reauthorization bill, the KIDS Act, to the floor before September 30th. So the program expired September the 30th. Here we are more than 100 days, I guess it's maybe 112 or something like that, days since it expired. Republicans had the power to get children's health insurance done by September 30th. They failed, despite the fact that there was a bill to do that. Could have passed on the floor very quickly. They have all the power to do it. To get it on the floor, they chose not to. That's bad enough, but it gets worse. They had all of the month of October. They did nothing on children's health insurance. All of the month of November, they did nothing on children's health insurance. All of the month of December, they did nothing on children's health insurance. Now, there's this newfound urgency to make sure that they criticize Democrats for not passing this defective piece of legislation that has major holes in it from the House that was developed only by the Freedom Caucus in the House, and we're supposed to accept, I guess, whatever the Freedom Caucus wants in the House. That's the way we're supposed to run the U.S. Senate. Why would Republicans, despite their assertions that they want to move the children's health insurance bill forward, why would they let all of October, all of November, all of December pass after they already let it expire? Why would they let all that time go by? It's not a mystery. We don't have to hire a private investigator to find out why they let it go that long. One reason, because for most of November, or all of November, but certainly all of December, until I guess about the 22nd of December, they were focused on one priority, their tax bill. A tax bill which is a giveaway to the super rich. Top 1% gets about $51,000 in year one. I hope everyone else is going to do that well. Sorry, they're not. But what did they do in that bill in addition to helping the wealthy? They gave big corporations not just the kind of tax cut that we've never seen before, more than almost $1.5 trillion to corporations, but they made it permanent. So they got permanent corporate tax relief when they should have been figuring out a way to get children's health insurance done. So that's the story of how we got from there to here. Now we hear that because there are changes in the cost of children's health, that this would be a 6-year bill. Well, that's a good amount of time, but guess what? Guess what? Because of all that change in the intervening period, we could do a 10-year children's health insurance program and save billions of dollars in doing it compared to what Republicans want to do now. So if there's this urgency to do something about children's health on the Republican side, I'd say let's join together and not only get children's health insurance done, today we could do it. We got all day today. We got all day tomorrow. We got a big weekend of work here. Let's get children's health insurance done. Let's knock something off the list. We don't have to worry about it. But while we're doing that, let's make it 10 years. I would argue children's health should be a permanent program. Permanent. Just like that tax cut for big corporations. They found a way to get corporations to get permanent tax relief. Why wouldn't you support permanent children's health insurance? But if they can't do that, we could at least do 10 years. That's easy to do right here today. A 10-year children's health insurance program so that 9 million kids and their families and 180,000 in Pennsylvania can have the certainty to know that despite the fact that it's over 100 days late because of Republican failure to get the job done, we could get it done right now, today. So let's see what they do. Here's another issue that we have to talk about because this bill that came over the House didn't address this issue. Community health centers. 800,000 people in Pennsylvania depend upon those community health centers. There's nothing in that bill that we voted on last night to address those 800,000 people in Pennsylvania and tens of millions across the country. The House bill didn't even touch that. I guess those people shouldn't have to worry. Community health centers. We know that after that expired, community health centers expired just like the children's health insurance program, and the Republicans have the majority. They could have made sure that those health centers continued, but they didn't. So after expiring, we know that these health centers faced a funding reduction of 60 to 70%. We also know that, at least in my state, of the 180,000 children covered on CHIP, something on the order of 9,000 children enrolled in the CHIP program go to community health centers. So having CHIP in place is essential, but having community health centers in place alongside it is also essential. What do those 9,000 kids in Pennsylvania do if they have CHIP coverage but can't go to the community health center down the street because it's closed, because it wasn't addressed by House Republicans or Senate Republicans? So while we're at it this weekend, why don't we get community health centers done? And in my state, 4,915 people work there, full-time jobs. 4,915 people. The third issue of 4, and I'll be done in a minute, tax extenders. Kind of another Washington phrase, right? Well, in this case, not getting these extenders done by the end of the year, which we almost always do, no matter who's in charge, but guess what? They didn't get to tax extenders for rural hospitals by the end of the year because guess what? They were working on their tax bill for big corporations and rich people. So rural hospitals got pushed aside, just like children's health got pushed aside, just like community health centers got pushed aside because they had to get their tax bill done for those big corporations and rich people. So tax extenders for rural hospitals didn't get done. Rural health providers face hundreds of billions of dollars of cuts across the nation. Now, I represent a state that has 67 counties, but but we have 48 counties of those 67 that are rural, okay? And in those communities, those 48 rural counties, about 279,000 people got health care, either through the Medicaid expansion or through the exchanges. And in those communities where there is a rural hospital, sometimes there's only one hospital for a long distance, those communities rely upon that hospital not just for health care, but for jobs. Sometimes in most places, it's the biggest employer in the county, or the second biggest employer. In my state, there's between 20 and 30 counties where the hospital is either 20 or 30 rural counties, where the hospital is either the biggest employer or the second biggest. So they need those tax provisions in place, but the majority did not get that done. Finally, Mr. President, I'll end with this. The senior senator from Michigan highlighted this, and I think it's important. Another thing that didn't get done, that wasn't in this bill coming over from the House, was an important program that we don't talk about enough. It's been in place a couple of years, the Maternal, Infant, and Early Childhood Home Visiting Program, an evidence-based home visiting program that supports at-risk pregnant women and young families. That didn't get done in this. It was not in the bill. In fiscal year 2017, funding for that program was $400 million. It's the right thing to do to have that in place. We know that just in Pennsylvania, for example, 3,282 families benefit from this program. That's another part of this bill that wasn't included. So if the majority is so concerned, as they professed last night, I wish they did this months ago, but just last night, breaking news, they're concerned about the Children's Health Insurance Program. Let's pass it today. Let's get it done today and make it a 10-year program. No one would have to worry for an entire decade about children's health insurance if the Republican majority wants to join us in that effort. Mr. President, I would yield the floor and note that the next speaker is the senior senator from Ohio, a great fighter for our kids and for our families.